Heparin is an anticoagulant. It promotes bleeding. It prolongs bleeding. It triggers and causes complications of bleeding. It is absolutely contraindicated by every known medical orthodox text on earth in patients with suspected closed hand injury or CNS bleeding or any otherwise such complications. Why? Because it causes brain bleeds.
If you give it to an individual with anemia and hypotension and it's about 9 times the therapeutic dose, of course you will have bleeding. The bleeding you have 3 types. One is organized, it means it's attached and there is fibrosis, and the other clotted and the other functioning. There are 3 stages. Now the theory of shaken baby syndrome, they said, is you shake the baby a few seconds and you get a bleeding. Now, if Alan or anybody shake the baby and there was a bleeding and the bleeding stopped right there, it means what do you expect? You expect to see one type of bleeding, not three stages of bleeding. So, how a forensic pathologist would miss that? I do not understand. The baby Alan, when they did a blood analysis, and he had more than 500,000 platelets per microliter of blood at the admission. It means this is normal or above normal. Why it's above normal a little bit? Because the baby has anemia, and this is we call hyperplasia. The baby lost about 40% of the platelets, and that show you the bleeding is happening after the admission. And who's doing that? Is the heparin. When you give heparin, the platelets stick together. When he see fresh bruises, the medical examiner will stand in court and say, these bruises, this bleeding is less than 1 day old. And he did the autopsy on November 29. And the baby was admitted on the 24th. What that tell you? It may tell you that bruises happen after giving that huge amount of heparin.